these types of diseases that cause problems, this is where we can have an impact in life.
It's literally like watching magic happen, and SciTech is one of those.
You see these people that have been suffering, you can see it in their faces. Then all of a sudden, they have a 1-hour treatment inside our machine, and immediately their response is that I can shake your hand, I can drink a glass of water.
You keep going at it to focus on better technology, bringing great technology to the world and helping patients.
Never be satisfied. You could always do better. You could always improve.
Like magic, that tremor's gone away completely almost.
You can't replace part of the brain.
Like, you treat them the same.
Source of truth for the medtech industry.
Coexists with the prophets.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s billion-dollar company that held up high. A lot of things.
The state of medtech with your host, Omar M. Khatib.
Hey everybody, welcome back to the show. I'm in beautiful Miami in a wonderful new studio. Big shout out to Jacopo and his team for having us over here. And crowd favorite is Dr. Maurice Ferré, who's the founder of Mako Surgical. You guys loved his episode, so we had to have him back on the show because his current company, InsideTech, I love all medtech companies, but there are some companies that, just in my opinion, it's literally like watching magic happen. And SciTech is one of those. So we're going to talk about the story behind it, the amazing work the team is doing, and a lot more. So Maurice, it's great to see you again. How are you doing?
Great to see you. I have to say, Omar, first and foremost, happy birthday.
Thank you.
I know that just to know that you came down here to Miami and you convinced your family to spend time here to do this podcast really means a lot. It just really means a lot. And I love what you're doing. I think it's so important to the medtech community to be able to use different types of formats and media. And we don't have enough visibility out there. And I think your platform is really doing something. I was amazed what happened in LSI and the type of visibility that you're getting. Keep on doing what you're doing, man.
It means a lot. And in terms of coming down here, so for the audience's perspective, my birthday was yesterday. My wife about a couple of weeks ago, or I think a week ago, when she said, "Hey, like, what do you want to do for your birthday?" And I don't like celebrate my birthday, but I'm like, we can have a family dinner. I was like, but I'm gonna ask for a little support. I'm gonna fly out on a red eye on my birthday night. She's like, to go where? I was like, to go to Miami. Maurice wants to do an episode. She's like, oh, absolutely. So I have the best wife in the world. I love her. She's very supportive. But anything that has to do with the show, 100% she's behind. But it makes it more special. I get to come out and hang out with you, post-birthday present. So I appreciate it. And again, we were speaking about it in the car. There are, founders and sort of, in my opinion, like sort of iconic people in our industry like yourself who, after your first rodeo, you had more than enough reason just to sit back on your laurels, enjoy life. Yeah. But you keep going at it to focus on better technology, bringing great technology to the world and helping patients. And again, you're at a stage in life that you don't have to be doing all this, but you're in the office, grinding it out, bringing together the best world-class people, best teams just to, further patient care. And so, from that, let's start with InsideTech. So how did InsideTech get started? And how did you get involved with it?
Before I get started, there's just one shout out that I want to make.
Well, you made many shouts on the show.
This shout out in particular because, and it's more of a personal story. Before I get into the InsideTech story,
please.
And I think we're gonna have plenty of time to get into the details of the journey of the InsideTech story. But from a personal standpoint, one of my very close friends, Yvonne Dalvik, was with me actually in all my companies. He was actually head of business development at GE when GE bought my first company. And then I eventually got him to Mako, and I just, he basically ended up running a lot of the operations at VTI. And then he came to Mako, and he was just a remarkable person in Mako. And when we sold Mako, Yvonne, who was very close to Frank Yoles and Maury Blumenfeld, which are some of the early pioneers working on focused ultrasound, with Kobe Vortman, and he said, we got to get involved with InsideTech. And I said, Yvonne, really? And so Yvonne got us into this, and Unfortunately, a few years ago, he passed away from pancreatic cancer, and I think about him a lot. He's a special soul, and he really kind of connects why we do what we do, right? Because these types of diseases that are so bearing, that cause problems, this is where we can have an impact in life, and this is what drives me. This is what drove me to get into InsideTech, is knowing that there's more work to be done. And there was a guy. I'll just say one last story. I used to work with a spine surgeon named Yvonne. Hanson's a giant in the industry of spine. Was very, very early on with a lot of the work that was done on A-lifts and cages and things like that. And he would always tell me, never be satisfied. Never be satisfied with anything. You could always do better. You could always improve, and you could do things. And I've taken that to heart. And the InsideTech story really, for me personally, is about this mission, about being mission-minded in life, about making a difference, leaving this place, this earth, in a better place than where it started. So with that, let me tell you about the InsideTech story. And
real quick, before you dive into that, regarding Yvonne, I did notice him because, something that stood out to me, and I really appreciated that, was, you have him still on the company website in memoriam, right? When you think about Yvonne, like, what was the most meaningful thing that he ever told you, or something that you learned from that you kind of always keep in mind that sort of keeps the spirit alive?
Yvonne was whenever I talked to him, a very common word that he would use is "bless you, bless you," and it was just one of these things that somebody who brought tranquility, insight into any layer of conversation, whether it was a personal issue, he would have a certain insight of navigating. He was the guy at the end that I would say, Yvonne, what do you think of this? How would you approach this? And these issues, a lot of them are on any topic, and they become very complex. And he always had a sense of grounding things in a perspective that just where it was just, boy, why didn't I think about that earlier? And that was an amazing talent. I think anybody who knew Yvonne would say the same.
I appreciate you sharing that. I think, there was a lot of great people in our industry that had such amazing impact that are no longer with us. And I think the best way, for me, it was my late mentor, Chris Sells. The best way to sort of keep them alive is to always share the lessons that they were imparted on us, that way they kind of continue on with us.
And he was the consummate optimist. And when he had pancreatic cancer, we had a body program at Stanford. We went to the FDA to get an approval for him to get treated with focused ultrasound. So it's like we got to do something in these types of diseases. We know we can solve these things and we can cure. And that's what drives our mission-minded focus at InsideTech. It's all about how we can improve quality of life, how we can improve life in our abilities in our field of medical devices.
So on that note, take us back to the day that you started with InsideTech.
Yeah.
What year we're talking about? What was going on?
Well, for me personally, it started actually in the 1990s when Kobe came to Boston, and he was looking at our technology. His team came to look at my companies. We were a company doing image-guided surgery, and we had a navigation system that was electromagnetic. And InsideTech was just getting started, and one of the key characters, was this gentleman by the name of Maurice Blumenfeld. And Maury was over at GE, and he was one of the gurus that really brought CT and MR to GE. And
this is late 90s, roughly?
This was early 90s.
So
this goes way back.
So correct me.
This goes even before. Before
your Mako days.
Before Mako days.
But that division at GE, I think, was like a unique moment in medtech history, because that division of GE, I believe, Omar Ishrak, Greg Lucier, all these big names, guys, they're all in one place.
and absolutely, and one of the big projects that GE was working on was building the operating room of the future. And there was a guy from DARPA named Rick Satava who was basically working with the Department of Defense to build the operating room of the future. And Maury was involved in that. And part of the concept, and Frank Yoles, who is another Hungarian just like Yvonne, and the really close ties between the two and connections. And Frank came and he ended up working at the surgical planning lab at the Brigham with Ron Kikinis. And they started working with Peter Black, who was a neurosurgeon, of building a double donor MR. And what they were looking for was some type of way of being able to do surgery with an electronic scalpel. And that's where this whole concept of focus ultrasound for Maury kind of popped up. And so I happened to have met Kobe in the 90s. And I had known about him all the way through and followed. And because Frank, who was my mentor, was always talking about InsideTech. And I'd go see through the cycles. You know, GE had made a big investment early on because their idea was to sell capital equipment, you know, to sell they were diagnostic, right? So they thought, oh, if we develop this, we will be able to sell more scanners. But what they didn't realize was that it's a different call point when you deal with neurosurgeons versus radiologists. So for many years, this was under the auspices of GE for many years. But in any case, fast forward, you know, post 2004, post the getting into, 2014, post Mako, I got a call from Maury Blumenfeld and saying, please, if you can look at InsideTech, and we, you know, at that time, they were looking at helping someone to finance the company, and I with Yvonne went up to New York and met with one of their larger shareholders, and we put an offer out there to finance the company, and after a couple cycles, it finally came through, and I kind of sat for a period of time as the chairman of the company for a few years. And then eventually I ended up becoming the CEO. And you know, I can't say more about the vision of Kobe Vortman and just how incredible his tenacity of being able to do what he did in that period of time.
So I gotta ask you. So you mentioned that you were chairman of InsideTech before you became CEO. So similarly, you know, another common is a mutual connection of ours. So Greg Lucier was chairman of NuVasive for some time, and it got to a point where they needed a new CEO, and the board was like, "Well, Greg, you've done this many times, so why don't you become CEO?" And he kind of like, I don't want to say he was forced to do it, but he essentially, you know, he just ended up having to do it. When you were asked to become CEO, I mean, you already went through like a real wild ride at Mako, you know, ups and downs and everything, and it ended up being a great success story. What was that conversation like, and what was it that made you decide to go from chairman to CEO? Because when you go from chairman to CEO, you're pretty much going from like, you know, you're in an ivory tower and you're enjoying life to like you're in the trenches as a CEO. It's a big decision, you know, not just for you, but also your family. So how did that conversation happen?
You know, I didn't put much thought into it. I just knew it was the right thing to do. It's what the company needed at the time, and I was happy to step in and do it. And you know, and when I did it, you know, first and foremost, you know, I would say I've been now at this for 10 years, and the world is different. Was different then, but I would start off with the first part of this is God bless ingenuity, because think about what and InsideTech is an Israeli company, and Kobe came out of the military and out of Rafael, which is like their top engineering firm. I I mean, these are the guys that built the Iron Dome and all the different types of technologies that you see. And then all of a sudden, you have a guy that's basically saying, guys, I want to develop a technology that uses ultrasound energy that goes through the skull and put holes in people's brain, and actually get funded for that and actually solve all these problems that are like serious physics problems. And it took years and years of trying to figure out how the ultrasound goes through the skull, being able to understand thermometry, understanding how to put instruments inside an MR, using real-time feedbacks. And all of a sudden, this concept of the operating room of the future, closed loop, incisionless, all started emerging over these years. And what InsideTech was looking for when I got there was somebody who could take it to commercialization. And that's where I kind of said, I'll step in and do this. I would say that InsideTech is like all these things. There's ups and downs. But the fundamental theme that I ask is, are we doing something that's going to have an impact in healthcare? Do we have something that solves a real problem? And the next part of that conversation is, well, yeah, of course, it's easy to say, yes, you do. But then you have to get into the details and just the layers and layers of how to execute on that. Mm-hmm. Because you see, what we saw was a technology, or what I saw was a technology in the brain where never before had anybody been developing this concept of incisionless surgery, and being able to do it with non-ionizing radiation, and being able to treat patients with really disabling diseases and immediately have an outcome and a result.
And that was the part that for me, like when people come into our industry, whether it's investors or general public, and they say like, well, what's really interesting? And SciTech is like one of like a handful of companies where I'm like, look, this is literally like magic, where, for the audience who's listening, if you go look up on YouTube, with focused ultrasound, you're essentially doing, to put it plainly, incisionless brain surgery. That's already like pretty amazing and remarkable when you think about it. But then you have a patient who comes in with an essential tremor. They're drawing, they can barely draw a circle. I mean, their hand is shaking terribly. And so if you think about the quality of life that person has, I mean, that's drawing a circle. So think about that person when they're trying to just drink some water, eat food, or, maybe they have a grandchild or a child and they're trying to do something. They don't have any quality of life. And then literally like magic, that tremor's gone away completely almost.
Yeah.
I mean, it's remarkable.
And if you put it into perspective, Omar, in the United States, there are about 7 million people that have essential tremor, and about 50% of them are refractive to medication. And there's really no alternatives other than getting an operation, like putting in a deep brain stimulation. And most patients that go out and get treated, it usually happens late in their life. The
like above the age of 60?
70s.
70s.
So
okay.
Our average age is it's a bimodal disease. It's actually a familial disease, so you're inherited. So it's not atypical to see that we're treating a brother and a sister, or a mother or a daughter, but the disease progresses over time, and it basically is a hyperactivity of some circuitry that goes from the thalamus in your brain up to the motor cortex. And a very long time ago, it was identified that if you actually do some lesioning or ablation, something that we see a lot in cardiac, and we can ablate a certain part of that thalamus, in the thalamus, the VIM, and we can create a lesion, we can reduce the hyperactivity. And we now have 7-year data where we have an effect of over 70%. Of patients with an effect after 5 years, and the quality of life is really significant. And it's just amazing to see how these patients, I'm always awed by their families that always show up in these procedures, and as Reese Cosgrove says, it makes grown men cry, because you see these people that have been suffering, you can see it in their faces, and then all of a sudden they have a 1-hour treatment inside our machine. And all of a sudden they come out of it, and immediately their response is that I can shake your hand, I can drink a glass of water, I can cook, I can do this, I can do that. And it's just amazing. And I've seen so many people get so emotional about the impact.
And understandably so, because when I think I think people are in much better health today than they were like 20, 30 years ago. So like when you mention somebody in their 70s, my father's going to be 80 this year. My father and I go golfing every other week, so like, I think we're getting to that point where like, I don't know, 70 is like the new 60 or new 50 or something. But, at the same token, for somebody to go through a more invasive procedure like deep brain stimulation, which I think for the average public, is very scary, is not happening. So there's, 7 million people with essential tremor in the US you had mentioned. What percentage of those roughly even seek medical intervention if pharmaceuticals don't work?
Actually, we know that only 3% of the patients are being treated. So we're just in the beginning of this cycle. And there's a real lesson to be learned of how you build a market here, because most of what we deal with, I mean, a lot of people don't even know what essential tremor means. They know Parkinson's, they know movement disorders, but when you say, have you ever heard of essential tremor? There's 10 times as many essential tremor patients as there are Parkinson's patients.
And for the audience who's listening, just so they understand that essential tremor is not a symptom of something like Parkinson. It's its own disease.
That's right.
It's completely separate. How is it, let's say, different than Parkinson's? When we think about like the pathophysiology.
Right. Well, I mean, Parkinson's is, what's happening over time. It's a progressive degenerative disease.
Mm-hmm.
So what you're seeing is the death of cells. You're seeing a reduction of dopamine in the brain, and you're seeing a progression where we don't even understand all the money that's been spent on trying to understand this disease. We don't even understand how it's formed and what's his etiology. But what we do know is with essential tremor, unlike Parkinson's, we can cure it. You can treat the symptom, and the specific symptom that you're treating is what the disease is, which is the movement disorder. And
using focused ultrasound to do that ablation pretty much is a cure for it.
It's a cure.
So when you had taken over as CEO, what year are we talking roughly?
This was, I think it was like 2000. I think it was like 2016.
And where was InsideTech in its regulatory pathway at that point?
Well, we had just gotten in 2016. We got our pivotal trial published with the New England Journal. So it was a landmark randomized control trial that was published in the New England Journal. And there we got the FDA approval.
What specifically was shown in that trial?
What was shown was the efficacy. Well, first the safety side of it in terms of the types of, we didn't see any serious adverse events, and what we saw were some of the minor adverse events that were the tingling of your mouth, some ataxia, things that with a much lower complication rate than what is normally done in DBS. We didn't have any complications around infection because we were not open.
There's no incision.
There's no incision.
So when you do this, can you describe?
Let me just say one thing, just to make sure that we said, but what we saw was over a 70% effect.
Wow.
And there was an effect on every patient. So it was just a matter of how much of an effect that occurred in that patient. So it was, and what's interesting about the field is for many years, the functional neurosurgeons, they first started off with RF ablation. So for many years, they had been doing RF ablation.
And RF stands for?
Radio frequency. So basically, this is putting a needle into your brain, and basically at the tip of the needle, you burn the target. So stereotactic approach where you put the needle into the brain and into the thalamus and you zap it, and you have an effect. So that was the standard of care of how to treat essential tremor. For this was in the 40s and 50s. 60s, in the 80s, all of a sudden there was an introduction of this whole new concept of deep brain stimulator that Medtronic put together. And when Medtronic looked at how they were going to approach this, essential tremor was the market that they actually targeted first before Parkinson's. But what they couldn't do is they couldn't convince patients that didn't have a progressive disease to actually have a surgery. So they've always struggled with that. And then they focused on Parkinson's and have done well with Parkinson's with deep brain stimulation. But what's interesting is in a very short period of time, we have now doubled the amount. Last year, we actually doubled the amount of procedures performed versus DBS in the United States. So we've become standard of care. We've only penetrated through 3% of the market. So when you kind of put it out in perspective, is that we're just in the early beginnings of InsideTech.
Because essentially, so just to summarize it back to you, that the number of DBS procedures that were done last year, in SciTech, you doubled it using focused ultrasound. But in terms of patients actually seeking treatment, we're still talking about 3 to 4% of that 7 million. So there's still a lot
combined. Both of us together as an alternative treatment for someone with refractive in essential tremor.
Got it. Now, you mentioned something I want to take you back to for the audience, that it's incisionless, right? So what department of the hospitals is done in? What is it? What does the technology look like? If you can describe it. For we'll throw up some pictures later in the show for those who are watching on YouTube and Spotify. But for those who are driving, can you describe the technology and what is it like?
Well, so first we work inside an MRI, and now we work inside with Siemens, with GE, and with Philips. So we work with a majority of the MR machines are now compatible with our technology.
Was that difficult to get set up to do those partnerships?
Absolutely.
Can we take we can call this a sidebar, as I like to say, a little side quest. So side quest, what was it like getting those partnerships? How difficult was that?
Look, when you think of, when I first got here, GE had a large stake in this company and they had exclusive. So we had to convince GE to give us a non-exclusive. That took a lot of work. That was the first thing that I did.
What was the? There's never a moment like it is, and it's not like a movie. But if you had to go back to this was sort of the negotiation lever that we pulled that helped. What was it? How did you convey them? Because we're talking about GE,
It was
right?
a perfect timing because GE was all confused about where they were and what they were trying to do. They were kind of figuring out their own existential. And
we're
the
talking.
basic CFO.
Was this right after the Jack Welch era? And this is
this is way after. This is way after. This is after Jeff Immelt. This is where GE is trying to figure out its identity.
What year are we talking roughly?
2014, 2015.
Okay, yeah. So got it.
Yeah. So this is before they split up and became,
They were still a behemoth company. They were. Yeah,
and
I remember those days.
This is before they actually split up and went public.
Yeah, so, and this happened, I think, just a couple years ago, where GE Healthcare has its own division, own stock,
and now
everything.
they're getting back into therapy. So you have these wax and wane views of these big companies that they change their strategy, and we just got caught up in the right time of being able, where they didn't have as much of an interest as they had before, and we were able to make a deal happen. But look. The more important part of the story is that it was the right thing to do because it gave us access to all these hospitals that were working with all different types of scanners to allow us to convince the hospitals, the doctors, to build up a program.
That was essentially, those MRI machines are your key distribution point. And so if you were limited only to GE, you may not even have done 3% of the population.
That's right.
Probably maybe even 1%.
That's right. And we know that we have to go. But also, one of the challenges that we have as a company, as InsideTech, is that we have to, our customer, yes, it's the hospital. And yes, we work with radiology. But it's really the champion is the neurosurgeon, the functional neurosurgeon.
Can you quick, for the audience, this is, it's not necessarily new, but for a lot of people who are new to MedTech or in MedTech, there's a difference between functional, like neurosurgery and functional neurology versus just, I'd say traditional. I don't want to say traditional, but when you say functional, what does that mean?
Well, so these are neurosurgeons that actually work with things like your circuitry. That work, which are functional in nature, right? So they're working with the thalamus, the putamen, the STN, all these parts of the brain. They usually are the ones that are putting in electrodes into the brain.
And these are the type of surgeons who would essentially also be doing things like BCI then,
Yes,
right?
yeah.
So that would you say it sounds like, I mean, as crazy as it sounds, I never thought I would see days like this, that there's an actual like subspecialty within neurosurgery, and it's this. Okay.
Yeah. And so these functional neurosurgeons, they understand how these parts of the brain, how these nuclei that are basically in the center of your brain operate. And you go 1 millimeter to the left or 1 millimeter to the right, you're gonna have a different effect. And they deal with all different types of parts of that part of the brain that are related to function. And from our perspective, these neurosurgeons, number one, they had been doing DBS and they thought that lesioning was a bad thing. So what we had to do was we had to convince that audience that this is a different type of lesioning than what was done 20 years ago with RF ablation.
And they were thinking about the needle with essentially using heat.
Using heat to go in with a stereotactic frame into the brain and put a needle in the brain and target that part of the brain. Because DBS had become such a standard of care. So we had to spend a lot of effort and energy. And this is why we have over 40 publications now of working with peer reviews, and not only working with the functional neurosurgeons, but also working with the neurologists, because the neurologists are the folks that are referring these patients to the functional neurosurgeons.
So you essentially had two markets where you had to drive behavior change within, and one specific for product adoption. Right. That's a big, so a
lot of complexity,
but your approach essentially, which I agree with, is to let the science speak for itself and overwhelm the market with data. with data points and proof points, because it's not enough just to have one or two.
Yeah.
Right.
And we've done a really good job. I think one of the things that we've done is our scientific community, both on the science, on the technology, and on the clinical side, we spend a lot of time working with the KOLs and getting publications out. And it's a very important thing to do, because at the end of the day, that's what's convincing people. And by the way, it's not just for convincing the change behavior from what was instilled. You have to re-educate people of what incisionless surgeries. You have to, it's like I don't understand this. Are you modulating or are you lesioning? And so it was that education, is going up on the podium, it's having publications in place, and that all takes time. And then you also have to get market access. You have to be able to get hospitals to get reimbursed. And the complexity, we now have over 250 million lives covered, but that took 4 or 5 years to just kind of build that up. And to me, at the end of the day, what the real message is, and when I started and got involved with this, I kind of knew what I was getting into, but there's so much, the level of what we do and the stage of where we're at really required a lot of focus. Focus on the technology working with the KOLs and getting the awareness out there, getting publications out there, getting enough data out there so that you can get reimbursements, and then building ROI models with the hospitals. And then all of a sudden you got to work with the patients and get the patient awareness program out there. And that's kind of where we're at now. We've got all these pieces finally all put together, and now we're starting to experience the benefit of all this together. And the incredible thing about it is, like, we're the only company in the world that does this.
That's fascinating. And it's exciting as well, because in order to actually help the remaining 6 point whatever million that are not seeking treatment, who are medication refractive, you had to set up the system so that when that patient goes, that they're going to be able to get captured, and there's a system for them to go through in terms of how are they clinically going to get treated, how's the hospital going to get reimbursed, because if any of those things don't exist, then it's a wasted effort. I want to go back to the 40 publications, because that's a lot of publications. Strategically, how do you decide what publications to do and when?
So strategically, I'm just.
I told you this is a laid back show, so
yeah,
if
no.
You can go
because I want to make sure that I got it was 40. Maybe it's a little less than 40, but it's not far off from 40. When I think about it, but I just want to make sure I got that number
for legal and quality. We'll say in that area,
in the 30s.
Yeah,
I would say something like that. It depends, but I do want to.
But more than 10, essentially.
Yeah, and if you go on our website, you'll see the exact.
Well,
number.
let me make it easier. Again, legal and regulatory. We're not going to get in trouble here. But so for the first 10, like, how do you decide what to do and where to do it?
Yeah.
Because clinical studies, it's not enough just to say, oh, we have all these clinical studies.
What's really
right?
amazing, what is amazing about what we do, okay, is that we attracted the best in class. And if you look at the USA News World Report, we have over 80% of all the hospitals. So all the top tier academic institutions all got involved with InsideTech at some level. And what we were able to do was be able to get the best minds together and basically come up with a strategy, which was a regulatory strategy because we're a class 3 device. Mm-hmm. And as a class 3 device, we needed to demonstrate, we had to do a randomized controlled trial that was blinded. And so the design, the first author was Dr. Elias from University of Virginia. And, the work that was done there at UVA and the support from the Focus Ultrasound Foundation with Dr. Cassell, also in Virginia, was really important because they were the kind of the accelerators, if you will. But it became evident that the biggest part of our strategy was to demonstrate efficacy. And the most amazing thing on the trial is that if you look at the p-value on the statistics, it was like 0.000, right? So it was
for those who are wondering, I was going to say that's like extremely statistically significant. On the
that's why we have an effect on every patient. And what's amazing is how this technology works. It's like what you have over 1,020 of these ultrasound phased array elements that are in a dome that go over your head. And what you do is you put a frame on the patient's head so nothing moves. You have these elements that are sitting there. Now, ultrasound doesn't do well with air. So what you have to do is you have to put water.
Right. And so like when you get a normal ultrasound, you have the gel. You have a medium for it.
We medium. So we have water, but it can't be any water. It has to be water without any bubbles because bubbles aren't good. Mm-hmm. It deflects. And then what happens with the ultrasound, we have to pick the right type of frequency. So at a higher frequency at 650 kilohertz, it basically is better than lower frequency ultrasound, where it doesn't the absorption of what goes through the brain and the targets are tighter. But then you have to deal with when the ultrasound beam, that's the patient goes inside the MR, they take the MRI images, they identify the target, and then all of a sudden it's like, okay, here's the target. I'm going after this specific target in the brain. We know exactly where it is in the brain. It's an anatomical target. And we do something that's really amazing. All of a sudden we've learned that if you take the temperature, when you get above 55, you create what's called a permanent lesion. But in the 40s, like in the 45, you basically have a modulation effect where it's not permanent. So what we're able to do is they'll go in, they'll target the brain. The beams will all converge into one specific target in the brain that's identified. And when they identify that target at 45 degrees, patients are on medication. So what they do is they actually go in and they give the patient a piece of paper and they write spirals. And you will see immediately an effect without having a permanent effect. And they will then modify and change the target based on that thermal tracking that we're able to do on that specific patient.
And when you modulate versus, let's say, completely, burn it, you said you like staying in the 40s. Is one of the reasons for that is to retain some ability for neuroplasticity to happen later on?
It's more. It's what we call a closed loop system. Because what we're able to do is before we cause a permanent damage or permanent lesion in the brain, which you can't reverse.
Right.
We can see if it has an effect, and that effect correlates to outcomes.
I see.
And that's why we have that. There is plasticity that's occurring. I mean, you are creating some type of effect there. That's creating the fewer. The target is by doing the modulation. You're at the cellular level, at the nuclear level. You're having an effect that's reducing the amount of action that's going up to the motor cortex because you're not getting the effect of the motion of the arm.
I want to go back to some of those clinical studies. And again, what's interesting about your story is, when I look at our industry, and specifically surgical robotics history, so Intuitive was the, big unicorn, but there was one robotic company that had the successful pathway of developing, commercializing, and exiting. That was Mako, right? And in a very, very tough time, by the way, very, very, very difficult time. And it was a great success story. So when you look at that commercialization pathway and those insights you got from that, when you came to InsideTech, what exactly did you do? Because you talked about getting all the right thought leaders and hospitals together to start focusing on the problem. What about the very beginning when you had none of those people? How did you decide who to go after? What venues did you use, whether it's like conferences or people, like taking back to those early days? Because I want to hear some trench stories,
Well, look, InsideTech, before I got there, was already doing a lot of this great work. So it wasn't that I had to recreate the wheel here. So they were really on a very good path of doing what we had to do here. And I think what I really brought to the equation early on was how to make this into a product. How can we commercialize? And there's different layers and levels of it, because this is a very technological, a complicated piece of equipment, and you got to make it work in a user friendly way. And I think a lot of our time and energy in the beginning was making sure that we did that, and that resulted in the release last year of the Prime, which is the next version, the next iteration of our technology that we're really excited about.
What with Prime, what were the main improvements on it?
I think that so first the user interface in terms of the
software
workflow,
side?
on the software side, a tremendous amount of work being able to look at thermometry in a three-dimensional way, for example, and be more predictive. So a lot of these AI elements were kind of integrated into it. On the hardware side, we changed some of the workflows in terms of the cleaning, the ability to clean faster, the water systems, and things like this. So these were some of the important things that really have resulted in our ability to integrate tractography, for example, and combine that into the system. We heard a lot from our customers that they have all different views of how they look at this in terms of their anatomical mapping. So we made it easier to port information in there, the workflow user interface capabilities and elements of it. And some of the ability, so on average, we can do more cases per day, which was a really important thing. A lot of our customers, we're starting to see something remarkable. We thought at first that we would be, 30, 40 cases a year was a good number. We're starting to see sites doing 200 cases a year, which for us is a big number in terms of how we're treating these types of diseases. And we're seeing sites actually doing 5 a day. So for those type of sites, the Prime really creates more efficiencies to be able to drive higher volume.
And in your opinion,
per day basis,
you feel like that InsideTech has, and focus ultrasound has become the standard of care for essential tremor. Is it mainly because you doubled what the old standard care, which was DBS, or how do you see it?
I think that we've won. And this is an ongoing process, right? But I would say that at most, first of all, everybody knows about MR-guided focused ultrasound, and they know about the exablate. They know about our technology. Any functional neurosurgeon that is in Parkinson's or essential tremor knows about this. So we've now taken that off the table. We now have strong, compelling data
Mhm.
that is 5-year data that supports the outcomes.
Got it.
And that I think is been a really significant part of this narrative. We've now actually worked and make sure that there's the reimbursements from the hospital's perspective and from the physician perspective work.
Mhm.
It's not the best, but it works, and we can make it work. And so I think you all of a sudden have those pieces. The piece that had been missing and is now starting to come together is patient awareness. How do you create these programs? And what our mindset has been, what we realized over the last few years, what's really important is to have a good ground game and being able to let the hospital know how to build a practice or a program. So it's not a transactional conversation. It's more about, we want to build a great program with you, with your hospital.
Like a center of excellence.
Center of excellence.
Yeah.
And how, but really demonstrate to them what best practices are. So we spend a lot of time and energy of letting our users talk to themselves. You know, we have something called every year, 2 of them, Focus Forward, which is where all the users get together, and they put their own agenda together in terms of what their best practices are.
I love that. And you know what's, I love that you mentioned that. I think more medtech companies need to do a better job of organizing people together.
Yeah.
You know, the one thing I always get asked because of the nature of the show and everything is like, oh, like, what do you think about AI and everything? And the one thing that I always tell people is that AI is not that great at 2 things. One is, to a certain extent, selling. It's not really good at that. The other one is organizing human beings.
Yeah.
And I think that it's really important for medtech companies to do a better job of bringing together these peers, because let's face it, like, you know, we're those days that you and I would, let's say, go to NAS or AAOS and everything, which are great societies. They're not these behemoth conferences where they all go now. So now it's all about these micro events, more specific events, you know. I'm going to take you on a side quest. Is that okay?
But I wanted to say one thing.
Yeah,
that I think is
please.
just so cool about why I love what we're doing. We have the most amazing user group. When I sit down and talk to our surgeons and that are using this, and all the people involved with the ecosystem of creating, they're just amazing. It's an amazing ecosystem of people that really care a lot about their patients. And they see the immediate results of, and it really creates a great program.
I love that.
And I think that's so important. It's like, that's one of the secret sauces of what we do. And you know, I'll tell you another thing that I think is a pearl that I've learned. One of my lessons learned of pearl is you've got to be vigilantly focused on your mission and what you're doing, and not have too many distractions, because the layers of what you need to be successful requires a lot of intensity.
Yeah, I completely agree with that, and it resonates with me, especially as a small business owner, because there's plenty of opportunities and shiny distractions, even as a medtech company. And I think in order to have, you know, as the saying goes, full steam ahead, you have to have a lot of the valves closed. You can't have all the valves open, you know?
And that's something that a lot of people don't realize. And at InsideTech, we're very focused. We see this still as a long ball. We actually think that there's going to be a point in time where people are going to look at incisionless surgery and they're not going to understand why it wasn't there before.
Oh, I completely agree with you.
I mean, it's InsideTech is transforming the way that these surgical procedures and brain therapy is being done, and we're just in the beginning of it.
And I will, you know, pay you and the team a compliment now that you mentioned it, because I didn't know if it was true or not. At least me from the outside, that's how I saw it. Was that I appreciated that, like, when I would go and when I originally read about you guys before I talked to you or JJ, anybody else, it stood out to me. I'm like, this team of people are extremely disciplined and focused, because I'm just reading about essential tremors. And a lot of times there's this desire, maybe medtech, we get influence from pharma, where the moment we get like clearance for the FDA, it's like, oh, how many different areas can we apply this to? And I feel like when you do that, instead of being, let's say, in your case, a meaningful specific, you kind of become a wandering generality, and you mean nothing to nobody, you know?
And people, you know, and it's 100%, because at the end of the day, we can't afford to be a science project. We have to be a real business.
Yeah.
And the only way to be a real business is understand how to grow your business. And growing your business requires you to be laser focused on or MR-guide focused.
There we go.
On your ability to execute on a plan, and that's why I'm excited that this year, last year we grew over 30%.
That's fantastic.
And in our procedures, and to me that's like really important. It's like we're starting to show some traction. We're starting to see the adoption that's required in this business, and so it's as my guy says, we now have a lot of momentum. Kind of going. So it's just this whole build up, and now we're kind of in this level. Now God knows what's going to happen with the economy in a recession or anything like that, and it's crazy that we're even talking about that type of stuff, or I'm mentioning it. But we finally have a lot of momentum that's going into this, and these distractions it's a worthy podcast to talk about how companies develop and innovate, because you have to have these. It's like how you can do these big things. And so we've taken the approach of, we have a platform technology. We're focused on the commercial side on essential tremor and Parkinson's. We are a neuro company. And so with that, what we have done is we're focused on our commercial business and enterprise. But we've been so fortunate to have such great users that do a lot of their site-initiated investigations. And we have a platform of a technology that enables us to do a whole bunch of other things, like open up the blood-brain barrier, to be able to do neuromodulation on different types of targets. And when you start getting the type of inbound coming in, like being on 60 Minutes.
Yeah, that was that was how I first saw you guys.
Yeah, it's like everyone says, and they say, well, is InsideTech doing that type of stuff? And the answer is not yet. Just stay tuned. We're let us get through our first layer of what success looks like.
And that beachhead essentially is essentially tremor.
Let's create that first. Let's create our first beachhead. And that first beachhead, by the way, if we kind of think about it, it's kind of the size of the prostate market.
Yeah, I was just gonna say that.
So when you do the comparison of like, can this be a multi-billion-dollar business? Absolutely.
Yeah.
And that's what we're into it. And we want to get there as fast as possible. And but we have to do it right. And we're being prudent about how we use our money. We're moving towards a model where we want to move towards profitability as quickly as possible. We've gone through a lot of cash, and now we're kind of at that level that last year, we hit $100 million in revenue.
That's fantastic.
And there's not
it's
a
a big
lot
milestone.
of companies out there.
No, there's not a lot of medtech companies out there.
Medtech companies that kind of reach that threshold.
No,
and that's something we're really proud of.
what you're commercializing is, I mean, it's a capital equipment, which is very difficult, and in I would say very blue ocean.
Yeah.
But SideQuest.
Yes.
Okay, SideQuest. So, LSI is a partner of the podcast.
Yes.
They're good friends of mine.
Great
They have great people, of course, amazing investor events, but also being the epicenter of medtech, they have the trust, their trusted market intel team. So I reached out to them and said, hey, Maurice is coming back on the show. We got to come up with some good market intel questions. So I got a question for you. So in your opinion, why do you think that ultrasound is one of the fastest growing energy-based devices? So according to LSI, growth in sales attributable to ultrasound-based energy devices are outpacing even the largest segments of the energy-based devices market with a CAGR of 7%, which is pretty high from 2024 to 2029. Why do you think that is?
I think people are starting to look at and realize that ultrasound can not only be used for diagnostic purposes, but be used for therapeutics. And we're starting to see companies that are starting to develop that.
On that note, what do you think are some of the obstacles to people seeking out this type of approach?
Yeah.
People as in the patients, not necessarily hospitals.
I think that, from our perspective, from InsideTech's perspective, we've been at this for many years. We're the world's leader in focused ultrasound. We've done more patients than anybody else out there that develops this. I think that there's layers of complexity of what you're trying to solve. It gets back to that first question: what are you trying to solve here? What are you trying to do here? It's one thing treating the brain. It's one thing treating the liver or the pancreas or the kidney, or the prostate. each one of them has a different level of needs of what you're trying to do. What's amazing about ultrasound is the mechanisms that we're learning about what we can do with ultrasound is pretty remarkable.
Yeah.
For example, we're at the 650, and we at the 650 we know we can create lesions, we can create heat, and we could create focal lesions at sub-millimeter level. When you think of what we can do at lower frequencies, we can open up the blood-brain barrier. So that's another modality.
Can you dive into that?
Whole level
Why?
of intensity.
I understand that, but for the audience, why is that important to open up the blood-brain barrier? What does that mean to open it up?
What one of the biggest challenges in the brain is, the brain is one of the most remarkable things of why we as a human species have survived all these years is because what I would say the most important organ in the brain, in the body, the brain, happens to have around the blood vessels, unlike any other organ, a call it a saran wrap, if you will.
Mm-hmm.
So that actually in the brain itself, blood doesn't get into the brain.
Mm-hmm.
So it's a good thing in that all these different types of pathogens and diseases, bacteria and viruses, that would attack the brain can't attack the brain because they can't get inside the brain. So that's the good side of it. The bad side of it is that we can't treat with drugs, a lot of drugs, because the drugs are too big.
And that's why you have refractive.
To get in the brain. They don't get in the brain.
Mm-hmm.
So these drugs don't get in the brain. So what we have done something brilliantly over the years was we identified, and it was the work that was done at the Brigham with Calero Hinneman at the time, who's now at Sunnybrook. But his work and the research that came out of that lab, really what they did was they started using these microbubbles that were put intravenously into the blood vessels. And what would happen is when the ultrasound energy hits those microbubbles, they expand. And then the expansion of those bubbles, what they would do, by inertia, they would pull what's called the tight junctions, which are the cellular connections in the endothelial cells that connect to the brain.
Mm-hmm.
It would basically just like open it up. And what we learned was that they would be opened up for about 24 hours. And then they would close
and then you
up.
can use those for therapies.
Then we can use it for
Wow,
therapy. So all of a
interesting.
sudden, we have an amazing ability. And so this was all research in the beginning. And what we realized was like one of the most important things that we did was we worked with Charles River Laboratory, CRL, which is one of the largest labs in the world that really works with non-human primates. We were able to get a system into Charles River Lab. And why that's important is because now pharma has a GMP facility to be able to do testing of all different types of drugs. And what's incredible, I'd say in the last 24 months, the inbound of interest coming in from pharma has been pretty remarkable.
That's amazing.
Where they want to understand, because pharma is like a different animal.
It's a different, people ask me this all the time. It's a different animal. It's a different world.
It's a different world.
It's like, I don't know, in MedTech, we're playing football. Pharma is, I don't know, playing like baseball or something.
Yeah.
It's like even
It's
more,
different.
it's very different. The people,
It's different.
the cultures,
they
everything.
They don't like the fact that, their idea of opening up the blood-brain barrier is using some type of chemical.
Right.
Right. They like a device. Were you kidding? Why would I use a device? But they're starting to realize, we've been able to publish. There's so many publications that are out there, a lot of labs that are working on this. So there's an enormous amount of interest in that area.
And I think it's important too, because based on the general public's awareness now, there's been a really big anti-pharma push.
Yeah.
I'm not anti-pharma, but I think what's better is combining these two modalities so that way you can have a better way to deliver therapeutics, and then you deliver less of them.
Right.
And I think that's what the public's
Well, I
demanding.
think that's going to be the future.
You know?
I think the future is going to be more focused, concentrated. Think about it. All of a sudden, you're getting pumped with all these drugs, right? Because a lot of them don't get into the brain, right?
Mm-hmm.
And then all of a sudden, if you can open up parts of the brain in a controlled way, and then all of a sudden you can put the drugs in there, you don't have to put as much drugs and have less of a side effect. So in theory, it makes a lot of sense of why this all can make sense and work together. But it's now about putting it into practice. And like everything, it's like these things take years and years to evolve, because first you have to demonstrate it, then you have to show the clinical efficacy. But most importantly for the pharma companies, it's all about safety. And before they make these big bets on these drugs or on these ways of doing these mechanisms, they have to have a lot of data.
And I think what's nice, what I like about this personally is there's this concept written by this guy named Alvin Toffler called the third wave. Steve Case, who founded AOL, wrote about it again. And the whole thing about the third wave, first, second, third wave of technology, is that in the third wave, because of how big the problems are and the way technology works, that the only way you're able to accomplish things is through partnership. In the past, we've seen partnerships in healthcare that just like went nowhere. I won't mention them, but they went nowhere. But now because there's a fiduciary responsibility to grow and it just makes sense, I feel like it's forcing pharma, biotech, and medtech to start doing these partnerships that make sense. Versus in the past, like pharma and medtech could be solving the exact same problem, but they have no relation with each other.
Right.
You know?
Look, my view of it is I think that you have cycles of innovation that occurs, and you have cycles of prosperity, and different approaches on how to solve big problems. So healthcare is a big problem, right? We can't sustain 18% GDP of healthcare. That's absolutely unacceptable. And you think about it, it's like there's so many inefficiencies in our system. So when tech companies start getting involved and say, I can solve this problem, I think that there's a lot of approaches to it. And I think they realize how complicated it is.
It's hard. It's really hard. And again, like
it's really hard.
I mean, look, I'll say it, but like, and again, I'm excited. I think it's an exciting time for our industry because all these companies like Apple, Google, Microsoft, they have a fiduciary responsibility to grow. Apple's not waking up tomorrow and saying, let's make furniture. Even Tim Cook said that their biggest contribution will be in healthcare. That being said, it's tough because like, we all remember when, who was it? Amazon, JP Morgan, and Berkshire Hathaway said, oh, we're going to save healthcare. And that thing wrapped up in like 2-3 years, and it's not because they weren't talented people, but because this is a really, really hard problem. It's very, very difficult.
Yeah. And look, and I take it back to InsideTech. So, we have the ability in what we're doing in movement disorders where we have an addressable $2 billion TAM. And beyond that, it's 20 billion. And when we start looking at other indications, we want to stay focused on our core business. We want to be able to get the groundswell of what this technology is and its capabilities as a platform. Once you establish that, then you can start moving the needle in terms of what you can do. One of the amazing things about InsideTech is that we're so far along in understanding all aspects of making this a really, truly successful product. And that just takes a lot of problem solving. And it's just like, you've got to have a right team in place at the right time to be able to execute on that plan. And that's, I think a lot of tech companies don't realize that. They just kind of come into this thing trying to solve these problems and don't realize how complex they are.
Yeah, extremely complex. And it's including the stakeholders. Like, as you mentioned, for you guys just to get going, you had to solve for the hospital as a customer, the clinician as a customer, two types of clinicians, plus the staff and support team around that. Then you start getting to the point of actually reaching patients. Now, one more side quest. One more side quest for you, because this one was
Omar, you're good on these side quests. I'm starting to pick up your rhythm here.
You know what? I have to give a shout out to the trusted market intel team over at LSI, because they know I like side quests. And so this is a question I was really excited to ask you. So when you think about InsideTech, how does Exablate compare to other energy-based devices for ablation of targeted parts of the brain? So Monteris's NeuroBlade, Medtronic's Visualace are major players in this segment. So what's the approach for acquiring new accounts, especially with a relatively niche market to compete over?
Well, I mean, it's the first part of what we talked about at the beginning of this podcast, is the fact that we can do this incisionless. And that's huge. I mean, the fact that you're basically using an energy source that's coming from the outside and going inside. And when those energy sources, those 1,020 elements all converge into one specific target, you have a lesion, you have the ability to ablate, which is what we do. When you look at all these other, Monteris or any other laser, RF, cryo, any of these type of things, what you're basically doing is you have to create an incision. You have to put these lasers or these needles in, And then what you're doing is the energy is actually from the center and it's dissipating out. So you can't always control how much energy goes out and what the side effect. When you look at our technology, our energy is coming from the out going in. So we're able to kind of have these very tight targeted lesions. And that's one of the things that we've been able to convince our user group to understand when we had to say, hey, this is a different type of lesioning that we're doing.
No, then you're good. And I mean, for the audience, just just so they know, you were feeling under the weather today, and so you still decided to come on to the show with us. So
Omar,
I really
this
appreciate
is for the world.
I appreciate
that,
it. So as we kind of wrap things up, I wanted to ask you, like, heading into 2025 and 2026, the focus now is on pushing patient education, right?
Yes.
And of course, on the other side, clinical adoption, because you don't have full clinical adoption. Yeah. How do you think about accomplishing that? And how does it kind of go hand in hand? Because again, going back to your whole key here about you guys do focus ultrasound, you have an event called Focus Forward. The whole idea is discipline and focus. Yeah. Yeah. How do you maintain that level of focus when you have sort of these two big, strategies you have to somehow pull together?
Yeah, no, look, I think that I think what I do is I challenge our team to really put their best thinking in on how to really get the adoption, because to me it's all about the adoption. It's about building programs up where patients are, that sites are maximizing their potential, and a lot of times our sites don't even realize how big a market it is or how many patients are out there in their population. So we can go inside the databases of every hospital and look at how many patients they have registered as essential tremor patients, just as an example, and we can give them demographics of saying, you're treating, your bandwidth is this. So why is it that you're not, treating as many patients as you should? Do you not want to? And most of them say, of course we want to. So what we do is we educate. We build up, we want to get motivated people, and we build up best practices. We have in our ability of going in and creating these steps of how to build the best practices, like how to build webinars. So we spend time teaching and educating our sites because they're not really good at that. They don't know how to, how to create a referring network of neurologists and primary care physicians. Because a lot of these patients, they're just sitting on the sidelines. They've known they've had essential tremor for
they
a long
need to be
time.
placed in the system for
they're
them
in the
to,
system, and they don't know. So what we're doing is we're taking best practices and we're teaching them and we're educating. So it's very much a ground game for what we do.
Why can't let's say InsideTech do that out on their own as well at a national level?
We do.
Okay.
We do. So we have a team of educators at a national level, and we basically have a call center. And so
you're able to refer them.
We're able to educate them, and then within the system, we don't tell them any specific hospital.
Right, you can't
but
refer
we'll
them.
say in your territory you have this, and it's been wildly successful. So we walked a lot of people. We educate them. We say, look, here's the difference of that. And that's one of the early things that I did is I really believe that building that ground game was one thing, but you had to build a D2C campaign. And so we actually do that. We spend time in terms of being able, if you go onto our website, you'll see that there you can take the quiz of whether you have essential tremor, and and then immediately it'll refer you to, do you want to talk to somebody?
For your D2C approach, is your main strategy essentially funneling traffic to this quiz, and then from that quiz, call center, and then distribute and educate and then distribute?
That's
is
right.
that the main?
That's right.
Do you know on the attribution side, like where most of these patients finding out about you? Is it through YouTube, Instagram? Is it Google search, or is it all over the place?
We see a lot of it is through social media. It's all really basically through social media, and we, and we use the large search engines to give us that patients. So it's really through that vehicle.
That's interesting. And then like I'm wondering when you do those, when you essentially utilize,
Yeah.
when you you know you're a hero for me. For
I'm good.
I know
I'm
you're
rock and
killing it. No, I appreciate it. When you're having these patients come through,
Yeah.
if they're in an area that doesn't necessarily service them, like what do you do with patients like that? Is that an opportunity for capital to go in and try and drive adoption?
I mean, I think what's amazing about our technology is, or the treatment of essential tremor is that we're able to, people will go travel almost anywhere, and we in the U.S. We now have 89 sites that are up and running, and so we're pretty much covered. We cover a large part of the it's accessible, and that's important. So we want to be able to get access, give access to these to our patient population that's out there.
Well, as we wrap up, Maurice, and again, thank you so much. One, for making the time, but also coming on the show when you weren't feeling when you're feeling under the weather. I really do appreciate that.
Yeah.
But just to kind of wrap up, kind of like taking a tiny side quest, a fun one.
Yeah.
But at your stage in your career and your
Yeah.
life, you've had a lot of influence from mentors and books and everything. But I'm wondering, if there are some books that really influenced you as an entrepreneur, and or things that mentors perhaps imparted onto you.
I tell you, there's, first I think anybody who does what we do, right? I think my first piece of advice is be a good listener, number one. Be patient, number two. Be thankful, number three, in everything that you do. And I would say, and find a mentor. I mean, if there's one thing that I was able to do, and I didn't realize, a lot of what was important to me was the impact and the effect of what people have to say. If you just listen to your voice, that's one voice. But if you can amplify different views and different perspectives and train yourself to synthesize those views and prioritize them and put them where they matter or don't matter, that's another talent set. And then all of a sudden you can be much more effective in processing information and making decisions quickly. These are the types of things that I think are really, really critical. I have to say that I did like reading recently Malcolm Gladwell's book that he just,
the newest one. That
he just did, which is the tipping point, but it was called The Revenge of the
Revenge.
Tipping Point.
That's right. Yeah.
And it's first of all, it's a great story because actually one of the stories is actually about Miami. And it was very cool because they mentioned my dad in the book.
That's awesome.
So it was really a cool thing. But I think that we need to get more people into the medical device space. And I think what you're doing, Omar, is doing it. And I'm a big fan of bringing people here to Miami. So please come to Miami, become an entrepreneur, come to the medical device world. LSI, move to Miami. We need you here.
I'll talk to Scott and we should do something.
We should
do
rock and
something
roll
here in Miami.
It's happening here. It's happening. We're starting to see a lot of we have over 1,000 medical device companies here.
There's a lot of excitement, a lot of talent too.
So the talent's here, and now we just have to take it to the next level of being able to take companies to the next iteration. And that's why I think it's so important that InsideTech really survives and succeeds here, because we set a good example of how it's done here in South Florida.
Absolutely. And look, based on everything that you've told me in this interview, no doubt you will be. I mean, I know plenty of companies who failed as a result of not being disciplined and not being focused enough. I never heard of a company that was too focused and disciplined. You guys are doing it all the right way. And more importantly, you took the right approach, doing it all through this, through science, getting the right adopters, and of course, taking these approaches. So Maurice, Thank you for coming on the show, and I appreciate it. For those who are listening, please give Maurice a follow. He is on LinkedIn. Be sure to check out InsideTech. Go to InsideTech.com and learn more. And if you learned a lot about this company on this episode, you like this episode, forward this on to somebody, whether it's an entrepreneur or an investor, especially somebody outside of the space, because we're always looking for ways to bring in new investment into the space. So that being said, I'm Omar Khatib, your host of the State of MedTech. Be sure to give us 5 stars, write a review. We're the #1 show for a reason, and we'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who would really enjoy and appreciate it. Share and spread the love. We'll see you all next time.